Well, I went to Kent State University and got an undergraduate degree in nursing and worked a couple of years in a couple of different hospital jobs, and also I was a camp nurse for the summers. And then I went back to graduate school to get my family nurse practitioner certificate and worked on an Indian reservation in Minnesota for a few years and found myself gravitating towards women's health. And in that setting, we also did prenatal care, and I just found that really enjoyable. So in time, I decided to go to graduate school again and get my master's degree in nurse midwifery. And before that time, I worked as a family nurse practitioner at Gallaudet University. I was an L&D nurse at GW Hospital and saw quintuplets born. So I've had a variety of experiences before midwifery, and since getting my midwife degree, I've worked in all settings: birth center, home birth, and hospital. So yeah, a variety. I was a midwife in solo practice in Culpeper for a short time, and then worked in the health department providing prenatal care for quite a number of years. I worked in Manassas for Manassas Midwifery, and we had a birth center above our offices. I've always worked kind of around the periphery of Fauquier, but never in Fauquier. But I was happy for the opportunity to work very close to home. My favorite appointment to do is probably the very first pregnancy visit, because then I feel like I'm getting her whole story. What this pregnancy means to her, her medical history, her birth experience, if she's already had a baby, where she works, and sometimes, to make small talk, we find out what her hobbies are, how well she eats, does she sleep well at night, what's her exercise of choice, just kind of the whole picture of her. And then so many months later in labor, there's a lot of opportunity for more conversation, and I like to hear how she and her partner met, and if they have a name for the baby, and is there a story behind the name, and all of that. So that's what I like. We do provide care for women much beyond just the pregnancy realm. Also, premenopause and postmenopause, and answering any questions that women might have about the whole transition and process of that, and making sure that, any concerns that they have are addressed. And I always like to find out if a woman has a primary care provider, because there's so many health maintenance, things on her to-do list that she should be taking care of with regard to vaccines and testing for cholesterol and getting her osteoporosis scan and such. Many of those we can order and manage, presuming that they're all healthy and normal. But it's always good for women to have a primary care provider in the event that they need one or have some need outside of the gynecologist midwife realm.